It's Jorge Delgado, and today I want to present a medical English video. My topic is ovarian cancer surgery. Definition: the ovaries are parts of the female reproductive system. They are responsible for the production of eggs and hormones such as estrogen and progesterone. Ovarian cancer is a disease in which cancer cells develop in the body, dividing and growing uncontrollably. As in other cancers, it can spread to the other tissues and metastasize.
The ovaries are the female reproductive glands. They consist of three types of cells: epithelial, germ, and stromal. When the cells in the ovaries grow abnormally, they develop into tumors that can be non-cancerous or cancerous. If cancerous tumors are not detected early, the cancer cells can spread from the ovaries throughout the pelvic region and continue to spread to the abdominal area and other organs. Determining the stage of ovarian cancer is very important in developing a treatment plan. At stage 1, cancer is limited to one or both of the ovaries. In stage 2, ovarian cancer extends to the pelvis area. In stage 3, ovarian cancer has spread to the abdominal region. In stage 4, ovarian cancer extends into the liver, or to locations beyond the abdominal area. Ovarian cancer treatment typically includes surgery, chemotherapy, radiation therapy, or a combination of therapies.
Signs and symptoms. The signs and symptoms of ovarian cancer may include the following: blurry of abdominal inflammation, with feeling of fullness with eating, weight loss, discomfort in the pelvic area, change in bowel habits such as constipation, frequent need to urinate.
Ovarian cancer is a subtle disease. It can sneak up on us like a thief in the night, disguised as common problems such as prolonged bloating, the constant need to pee, and fatigue. While the warnings are the same, the most common type of ovarian cancer begins in epithelial cells, a type of cell that makes up the tissue covering the ovary surface. To best treat ovarian cancer, doctors at Roswell Park first confirm the diagnosis and learn the stage or extent of the cancer. This requires a procedure called surgical staging, during which a surgeon carefully examines your pelvic and abdominal areas. The stage of ovarian cancer is determined by where cancer cells are found in the body. In stage 1, ovarian cancer is found in or on the surface of one or both ovaries or fallopian tubes, or in fluid collected from the abdomen. In stage 2, the cancer has spread from its initial site to other areas of the pelvis, such as the ovaries, fallopian tubes, and the uterus. Finding cancer only in the lining of the abdomen is also considered stage 2. Stage 3 means that the cancer has spread outside the pelvis and is found in other parts of the abdomen, nearby lymph nodes, or on the surface of the liver or spleen. The cancer has reached stage 4 when it's spread beyond the abdomen into other parts of the body, such as the liver, lungs, bones, or in the lymph nodes in the groin. At Roswell Park, we have a highly experienced team of board-certified gynecologic oncologists who focus specifically on gynecological cancers. Know your body. Ovarian cancer whispers. So listen.
Ovarian cancer in Ecuador. Ovarian cancer in Ecuador represents 2.7% of all new cases of cancer detected in women per year. This cancer is more frequent in women from 45 to 59 years old, with 42% of detected cases of the period. Treating ovarian cancer. Ovarian cancer treatment has two approaches. Local treatment including surgery and radiation therapy. System treatment including chemotherapy, hormone therapy, and target therapy. Treatment depends on medical criteria and the stage of the cancer.
Hello, I'm Dr. Stephen Andrews, a gynecologic oncologist in Summa Women's Health Institute. I'm here today to discuss ovarian cancer, the fifth leading cause of cancer-related death among American women and the deadliest type of gynecologic cancer. Today, let's talk about treatment and recovery for ovarian cancer. Treatment is most effective when ovarian cancer is found and treated early. The main treatment options for ovarian cancer include surgery, chemotherapy, hormone therapy, and targeted therapy. The primary form of treatment is surgery. Summa surgeons are highly skilled and experienced, offering minimally invasive robotic-assisted surgical techniques, especially for those patients with an early stage ovarian cancer, which often means a quicker recovery. Gynecologic oncologists at Summa are unique because we manage chemotherapy treatments if needed, so we're able to stay with our patients through her entire journey towards survivorship. For more information, please visit summahealth.org/womens. Thank you.
Surgery for ovarian cancer. Surgery is the main treatment for the most ovarian cancer. For epithelial cancer from surgery has two main goals, staging and volume reduction. Volume reduction is very important where ovarian cancer has already spread throughout the abdomen at the time of surgery. For germ cells, tumors, and stromal tumors, the main goal of surgery is to remove the cancer. Most ovarian germ cell tumors are treated with hysterectomy and bilateral salpingo oophorectomy.
So in the United States, each year, roughly 20 to 22,000 women are diagnosed with ovarian cancer. Ovarian cancer is actually a spectrum of diseases, which the majority of them are high-grade serous cancers, and that's the most common type of ovarian cancer. And they start in different portions of the ovary and can spread to different areas within the abdominal or pelvic cavity, but also to the other GYN organs. Most patients present with abdominal bloating, abdominal discomfort, changes in their bowel habits, or even just this general feeling unwell. These are the most common presenting signs of ovarian cancer, and unfortunately they represent signs and symptoms that do present at advanced stage disease. When it comes to treating ovarian cancer, the bulk of patients present with advanced stage disease, so a combination of surgery and chemotherapy is almost always utilized. With respect to patients with early stage ovarian cancer, many of these patients can be dealt with and be surgically treated alone without the need for chemotherapy. But a sequence of chemotherapy and surgery, or surgery then chemotherapy, is the way most patients with advanced stage ovarian cancer are treated. One of the most challenging things when it comes to dealing with ovarian cancer has to do with the way it spreads. Ovarian cancer typically doesn't just start in a central area and spread to things that are nearby. Fragments of tumor can be disseminated throughout the abdominal and pelvic cavity. So each of those tumor fragments that spreads from the ovary can land on different organs within the abdominal and pelvic cavity and grow larger. So a large number of organs can actually be affected. And the most influential factor when it comes to patients' survival and prognosis when it comes to ovarian cancer is a successful surgery. Okay, and so the surgery itself can be very complicated in the fact that all of those tumor implants have to be addressed at the time of surgery. Now, with our own institution, we've found that the surgery is much more likely to be successful, or we can increase the effectiveness of the surgery itself when we utilize multiple specialties. So not just a GYN oncologist, but also specialists that work on the liver, or specialists that operate on the pancreas or the spleen, or even specialists that specialize in surgery on the colon. Utilizing this team approach can increase the likelihood of having successful surgery by as much as 20%. So we oftentimes will talk with patients preoperatively based off of their CT scan findings that one of these other surgeons at the time of surgery may be useful in offering the best quality surgery for that patient. So surgery plays such a strong role when it comes to patients' longevity and how well they do afterwards. And then how to deliver that surgery in a meaningful way is really a strong interest of mine. Okay, so when it comes to the research that we've been doing at the Brigham and Women's Hospital, it really is looking at how best to deliver high quality surgery to patients with ovarian cancer. We've looked at what patients truly benefit the most from getting their surgery up front versus patients that get chemotherapy up front and then have their surgery at a later point. Some patients truly do benefit from having their surgery up front, and some patients truly benefit from having their chemotherapy done first and then having their surgery after that. We've identified patients with a large volume disease at diagnosis and patients that are elderly or otherwise frail. Those patients really do benefit from having chemotherapy up front. In addition, there's a lot of data to show that patients truly benefit from surgery at centers that see a lot of ovarian cancer and with surgeons that deal with this more frequently. Patients have better outcomes, they have fewer complications, and their survivals are superior to going to places that deal with this less frequently. The Brigham and Women's Hospital is connected with the Dana-Farber Cancer Institute when it comes to dealing with patients with ovarian cancer. Though the surgery will be delivered at the Brigham and Women's Hospital, oftentimes we'll see patients preoperatively, postoperatively, and even bring that connection to getting them on to the next step of delivering chemotherapy at the Dana-Farber Cancer Institute. Also, by our connection with the Dana-Farber Institute, the patients will have access to many clinical trials, both in the upfront setting and also in the recurrent setting with managing their ovarian cancer.